Donald Bourne, delegate from the University of Pittsburgh, speaking on behalf of the authorship team and the entire PittMed AMA medical student section in support of this resolution. This resolution, calling on the AMA to neutralize its blanket opposition to single-payer health insurance, received widespread support in the VRC testimony. Out of 63 posts, only 2 were against it. Multiple regions have endorsed it, and the MSS itself has policy supporting a single-payer healthcare system. Before medical school, I worked within the Department of Veterans Affairs, which is the largest single-payer system in the United States. Because of this, access to care and financial burdens were less of an issue for our patients, and physicians didn't have to deal with issues of prior authorization or malpractice insurance because patients didn't need to sue for future medical costs. As referenced in the resolution, surveys showed that more and more physicians are open to the idea of a single-payer system, and multiple state medical societies have passed resolutions supporting or neutralizing their language against single-payer. It's time our AMA update their policies in accordance with the viewpoints of its membership. Again, speaking in support of this resolution, thank you for your consideration.
Hi, my name is Roberta Barnes, and I'm a fourth-year medical student at SUNY Upstate Medical University, an AMA student member from Region 7. I wanted to give my support for Resolution 48, expanding the AMA's position on healthcare reform options, so that the AMA adopts a neutral stance on a single-payer healthcare system. I have been an activist for a single-payer national healthcare system for years, starting with the story of my own denial of healthcare for a surgery I badly needed, and after hearing from a family who had to let their child die of a rare condition they couldn't afford the treatment for. I am also speaking out on behalf of my patients who suffered quietly after health insurance denials and unaffordable pharmacy prescription copays. I will be a part of the next generation of doctors, and it is time the AMA updates their policies to reflect the viewpoints of its new membership. Thank you.
Hello, my name is Mo Kinsinger. I'm an M3 at Northwestern Feinberg in Chicago, and I am testifying in support of this resolution. The overwhelming majority of medical students and trainees I've spoken to strongly support a single-payer system. And so I believe it's ultimately in the AMA's own best interest to take an open stance toward this issue. If the AMA hopes to survive as an organization, they will need to persuade the rising generation of physicians to join them. And to convince my generation to pay their dues, it is absolutely essential that this resolution be passed. I personally believe single-payer healthcare would be superior to our current convoluted system because, at the end of the day, insurance executives are not elected officials, and therefore they're unaccountable to the American public. These executives have no conceivable motivation to provide quality, comprehensive medical care for all people, as clearly any physician would desire. From rampant private insurance denials of valid medical claims to labyrinthine prior authorization pathways, many of the frustrations that plague modern physicians, the same frustrations that the AMA exists to represent and elevate, would be entirely solved by banishing private greed from our healthcare system. The AMA should pass this resolution not only in a spirit of self-preservation, but also because it is ultimately in the best interest of their constituents, American physicians. Thank you for listening to my testimony.
Hello, my name is Ryan Parnell. I'm a fourth-year medical student at the University of Illinois at Chicago, and I'm speaking on behalf of myself in support of this resolution. Throughout my 4 years of medical school, I've witnessed the negative ramifications of a private health insurance system on Chicagoans in every neighborhood of this city. Every day, people from across the city, along with millions of their fellow Americans across the country, are excluded from our healthcare system on financial grounds, delaying much-needed medical care and losing trust in the system that is supposed to care for them. Allowing these individuals to remain excluded from our healthcare system has led to the worst outcomes in the industrialized world, accounting for thousands of preventable deaths every year. This failing system undermines the credibility of physicians and violates the fundamental do no harm principle of our profession. This privatized for-profit system has created perverse incentives throughout the healthcare system, and structural reform is necessary to realign the priorities of the United States healthcare system. Neutralizing the AMA stance against single-payer healthcare advocacy is a necessary step to creating a more equitable distribution of healthcare resources in this nation and I strongly urge the committee to adopt this resolution. Thank you.
Joey Ballard, delegate from Indiana University School of Medicine, Region 5, speaking on behalf of myself in support of this resolution as amended by the reference committee. This is one of the most important resolutions we can devote our time and resources to supporting. We are long past due when it comes to addressing our healthcare system. It is a system that faults patients for not having enough resources, for being in between jobs, or for just being unable to navigate its complexity during their most vulnerable times. Patients end up in collections with plummeting credit scores, all for a bill they shouldn't have to pay. Our system is unsustainable for the numerous rural hospitals that have already closed and many more that are barely hanging on. We have a triad of dysfunction: worse outcomes, poor access, and higher costs. The status quo has a demonstrated track record of failure, so how can continuing the same thing be a viable option? The patchwork coverage under our pluralistic system always leaves patients out. As medical students, we're able to see the system for what it really is. I hope that we can continue to lead the AMA on this important issue, if not for ourselves, then for our patients, because they deserve better. Again, I speak in support of this resolution as amended and oppose efforts to extract it. Thank you for your consideration.
My name is Jolie Hannon, and I'm an M4 at the University of Washington. I'm testifying in support of this resolution because I think the AMA expanding its dialogue on health insurance reform, including a single-payer system, is critical to helping support the sustainability of our healthcare system in the U.S. As students, we often have very limited training on health insurance and then enter clinical settings quickly exposed to how detrimental our current structure is, with providers overburdened by insurance logistics and patients navigating nuanced networks that may require a detailed level of health literacy. Of particular interest to myself as an aspiring OB-GYN, research on maternal mortality in the U.S. demonstrated that lack of access to insurance around the timing of pregnancy significantly impacts maternal health. For example, Medicaid expansions have allowed for improved coverage for mothers in many states, but in states that did not expand Medicaid, the maternal mortality rate has worsened, showing a gap in our current system. No patients should ever face a gap in insurance coverage that would lead to significantly worsened outcomes. This resolution allows discussion within the AMA surrounding a single-payer health system and helps move toward a safer, more just, and more viable health system.
Hi, I'm Jonathan Irby from Rocky Vista University in Colorado, speaking on behalf of the Colorado Medical Society, RVU chapter, in support of this resolution. I received my master's in healthcare deliveries from Arizona State, where a major part of my studies were focused on the incredibly high healthcare costs for the relatively poor health outcomes we experience in the US. On top of improving access to care, a single-payer model would incentivize the use of that money for more preventative care measures that have been proven to be the most effective way to improve public health, essentially forcing the system to work for the people that need it the most. This would not only improve health equity in the US, but reduce the amount of money being wasted in our current system and make our future careers easier and more impactful. I believe it is well within our best interests, both selfishly and altruistically, to pass this resolution. Thank you for taking my testimony into consideration.
Hello, my name is Scotty Killian, and I am a third-year medical student at the University of Washington School of Medicine. I am one of 20 students in my class from the wonderful state of Wyoming, and I'm here to speak on my own behalf in support of this resolution. Wyoming is struggling. This can be said of our state's economic outlook, social cohesion, and healthcare. As the least populous state in the nation, it is no surprise we have the lowest number of physicians, but we also have the lowest number of physicians per capita. As a result, my family spent our vacations in Denver, 6 hours away, balancing our time between Denver Children's for my brother to see specialists and seeing reptiles at the zoo. If inclement weather struck, as often happens, we'd miss an appointment and be put on another months-long waiting list for care. Across the state, labor and delivery units are being closed, including the one in Rawlins, Wyoming, where my grandmother and father were both born. The hospital CEO's solution to this crisis: they can drive to Laramie, a route that was closed 9% of the days this winter. We have the worst suicide rate in the nation, a title held since 2018, and as someone with a personal and family history of anxiety and depression, a public health crisis that hits close to home. Despite these problems, our state has refused to expand Medicaid, leaving Wyomingites as among 2.1 million Americans without health insurance in the 10 states that have not passed Medicaid expansion. I believe that it is apparent that our current healthcare system is drastically failing rural areas like my home state. Piecemeal, moderate solutions have not helped us. We need something big, and we need something urgently. We need single-payer healthcare. Please consider supporting this resolution and neutralize the AMA's language towards a single-payer healthcare system. You don't have to agree with it yet, but shouldn't we as future physicians allow for a full and robust discussion of all the options in order to fix this obviously broken system? Thank you for your time.
My name is James Waters, and I am an M3 from Cooper Medical School in Camden, New Jersey, speaking on behalf of myself in support of this resolution. Like many other schools, Cooper has a student-run clinic that provides free health care to the patients in our community. The vast majority of these patients have many different medical conditions, and some of them have never even seen a doctor before. I remember one patient, a man in his 40s, broke down into tears in front of me because he was finally getting help. Without our clinic and other similar clinics, patients like him would no longer receive any medical care or even seek treatment due to the prohibitive cost of insurance and of receiving care. This is something that simply does not happen in other countries and is not a feature of an equitable healthcare system. Citizens of other countries just don't have to worry about the cost of care. As future physicians, we are tasked with molding our country's system to be as humane and as equitable as possible. I, like many others here today, believe that starts with a single-payer system and with the AMA. This resolution can bring us much closer to implementing a single-payer system in the U.S. and to providing the best care possible to all patients, not just the ones that can afford it. Therefore, I strongly support the passage of this resolution.
Hi, my name is Edward. I'm a fourth-year medical student at Eastern Virginia Med School, and I'm speaking on behalf of myself in strong support for this resolution to neutralize anti-single-payer language in the AMA. It's time for the AMA to stop giving us lip service about wanting to expand healthcare to Americans and actually start promoting a healthcare system that actually does. And the way it can start is by considering all potential solutions, including single payer, which I would like to remind you all is being successfully used in countries all across the world and also in the United States itself in the form of traditional Medicare. In a single-payer system, people do not have to choose between getting potentially life-saving treatment and going bankrupt. In other words, people are not deemed unworthy of life because they don't serve the bottom line of special interest. Take the tragic story of Daniel Desnoyers, a man who suffered from depression and psychosis, who took his own life because he could not pay for his antipsychotic medications. His story and many others would not have happened in any other developed country, especially in one with single payer. In conclusion, I hope the AMA can broaden its horizons and consider single payer as a means of delivering high quality healthcare to all Americans. I recommend the AMA adopt this resolution to neutralize anti-single payer language. Thank you for your time.
The ideal that health is a human right is becoming more and more universally supported, even by powerful institutions such as the World Health Organization. Despite physicians wanting to do the best for each of their patients, it's arguably impossible to provide adequate and equitable care due to constraints of the private insurance model. I recall witnessing daily discrepancies in care as a medical assistant at a physiatry clinic specializing in spine rehabilitation. While Medicare patients were able to obtain timely MRIs necessary for diagnosing the source of their injury, as well as procedures to treat it, patients with commercial insurance, Medicare Advantage plans, and even occasionally Medicaid had to prove their pain, which often prevented them from achieving the simplest tasks such as grocery shopping or playing with their children, would not resolve after almost 2 months of treatments and medications that we providers knew weren't going to work from the very beginning, all in order for a chance to get that prior authorization approved. It's necessary for us to act on the value we learned in medical school on day one, to do no harm. If we continue rejecting the concept of single-payer healthcare, more patients are going to suffer unnecessarily. So please consider taking a neutral stance on the subject of single-payer, which would allow the necessary discussions on how we can reform the healthcare system to become the equitable one that we all wish to achieve. Thank you for your consideration.
Hello, I'm Michael Massey, a student from Northeast Ohio Medical University, speaking on behalf of myself in strong support of this resolution. When it comes to healthcare reform discussions, I do trust that we all share the same values and want all of our patients to have access to high-quality, affordable healthcare. That being said, in the US today, 4 out of 10 Americans have medical debt. This debt ruins their credit score and makes it more difficult for them to get a loan, get hired, or secure affordable housing. Worse yet, this debt scares people away from receiving life-saving medical care. I witnessed this firsthand at a free clinic where a patient with uncontrolled type 1 diabetes was recommended to a healthcare facility that could actually provide all the care he needed. The patient was scared for his health and agreed to follow up until he heard the name of the facility. He responded to the physician by saying, "But I owe them money. I don't know if they'll take me." Despite the physician's reassurances, the patient left without actually confirming if he'd follow up. And I know that public reforms to healthcare are worrisome to some AMA members. What I want to emphasize is that any mismanaged system, public or private, will be a bad system. And our current bloated insurance market dangerously incentivizes profit at the expense of patient care and physician efficiency. I hope that the medical student section votes to pass this resolution onto the AMA so we can open up an honest conversation about a healthcare reform option that is well studied with overwhelmingly positive reports, as it is clear our system needs to improve. Thank you for your consideration.